cracked tooth syndrome is when a patient will come into us and they've got a tooth that is pressure sensitive. Now, pressure sensitivity usually happens in this way. The person will go along and everything's been great, and they bite down, they're like, boy, they can really feel it. They've got a sharp pain. And patients even said, they took the food out and they were looking for something hard, and there wasn't anything. Well, they may go a month and a half, and then it happens again. And what we find is it happens in episodes, and the episodes become more frequent. And at first, it had to be something really, really hard, like a little bit of hard bacon or a seed or something. And further on, they bite down on white bread and it hurts. So I tell people, your tooth is a living thing. There's a nerve inside there. Boy, once you have that sensitivity, come in, because it will spread if we don't treat it. And what we do is if your tooth is cracked, we surround it with a crown. We hold the halves together. Fillings just aren't strong enough to do that kind of work. And then that crown can kind of support the tooth and take some punishment, and it looks like a tooth. All right. Now, the danger in waiting is if it splits further, the nerve is in there. And if it goes into the nerve, then you need a crown and a root canal. And occasionally, and this is the real nightmare, occasionally you can do a crown and a root canal, and then the person will come back in telling you it's still pressure sensitive. Now, they wouldn't have any hot or cold problems because there's no nerve, but if it's still pressure sensitive at that point, they're going to lose their tooth. And the bad thing about it is we don't take MRIs of teeth. And so on an x-ray, if this side of your tooth is cracked and that half isn't, by the time you shine an x-ray through a solid half of tooth and bone, you're not going to see that crack. And cracks don't happen like a saw blade cut. It's more like when your windshield cracks. It's an irregular fracture. So we chase symptoms. So I tell people, boy, once you get the symptom, come in, let's address it.